Hey everyone, my name is Robert Libbey. I'm coming to you from Vancouver, Canada. I'm happy to be talking with Dave Sheehan from Connect, and we're going to be talking about all things ligaments, so stay tuned.
Hi, I'm Aubrey Gowing, and I'm delighted to announce that I have been invited to be the international keynote speaker at the 2023 Conference for Massage and Myotherapy Australia. And this year it's in Auckland, New Zealand, so we're partnering with Massage New Zealand. In addition to delivering a keynote address, I'm also going to be giving a pre-conference workshop and also giving another demonstration where I'm going to be talking about pelvic torsion and back pain. So back pain is kind of complex. It is a multifaceted condition, but yet there's a finite number of structures that can be contributing to your client's back pain. So in this presentation, I'm going to be talking about the anatomy in the area. We're going to be looking at potential contributors to your client's back pain, how to recognize and test for these, but then also how to treat them. So I hope you can join us in Auckland, New Zealand for this amazing 20th anniversary event. Hope to see you there, folks. Thank you. Bye-bye.
Hey everybody, this is Dave Sheehan from The Connect Show. I'm very excited this episode. We have Robert Libbey all the way from Vancouver, Canada. G'day, how you going, Robert?
Doing very well, thank you very much. I'm so excited to be here with you guys.
Now, many of you at home listening in, watching into this episode, might be familiar with Robert's article, or articles. There were two articles in our journal. Those two journals, our Massage Myotherapy journal, talking specifically on LAST, which is Ligamentous Articular Strain Technique. And we're going to get into that a little bit. But before we do, Robert, can you just explain to the folks at home a little bit about your background? Because you've come from sort of a massage background, but you've sort of branched out into other bits and pieces as well. Is that correct?
Yeah, I've been practicing since 1994, so I'm going into 29 years at this point.
Yeah.
That went by fast, man. Like I just graduated yesterday, it seems. Um, but yeah, I graduated in 94. I've been practicing 29 years in Vancouver, British Columbia. I got interested in joint injuries early on, mainly because I had had a number of them growing up. I'd had hip fractures and a wrist fractures and stuff from my teenage years. So I got interested because of previous injuries and the anatomy and physiology information that we had at that time. It just seemed to be a little bit lacking. So I kind of sunk my teeth into it from then until currently.
Yeah. No, it's great to have you on this show because I've got a feeling from my understanding that any focus on ligaments from a soft tissue point of view, in our curriculum for massage and remedial therapies and myotherapies, there isn't as much emphasis on that. So I think the stuff that you teach both in Canada and other parts of the world is kind of really interesting and very relevant, and something that's not really seen so much out here in Australia. Give us a little bit of a background on LAST, because it's not just yourself that practices these techniques. Is that right?
Yeah, ligamentous articular strain technique is an osteopathic technique that was created by Andrew Taylor Still. William Sutherland applied it to the cranium, so that became Sutherland cranial. And then it's been passed along, throughout the years.
Yeah.
The Dallas Osteopathic Study Group back in, the early 2000s, they put out a little book of their version of ligamentous articular strain technique. So I had been interested in it before that, and had been studying and reading up on all of Andrew Taylor Still's and William Sutherland's writings that I could find through all the osteopathic literature that I could find. Their book came out, and it provided a little bit of assistance to that. But then I started applying all of the principles that Andrew Taylor Still had come up with to every joint that I could get my hands on.
So are we talking more sort of an indirect technique, or would you consider it indirect?
Yeah, so the term indirect and direct from the osteopathic world means sort of like a joint mobilization technique would be an indirect technique, or more of a subtle, like a cranial osteopathic technique applied to a peripheral joint would be an indirect technique. A direct technique through osteopathy is what the chiropractors use, like a high velocity, low amplitude thrust. Now that's outside of our scope of practice. So terminology wise, everything that I do would be considered an indirect technique. Now I've gone through and I've sort of redefined direct and indirect based on current evidence-informed research on the nervous system, and I've sort of applied it to the sympathetic and the parasympathetic nervous systems. So an indirect technique, there's a thing called a reciprocal tension of the tissue. So an easy example would be that if you poke somebody quickly in the abdomen, they tighten up really quickly. But if you go in really slow, well, then you can touch the anterior bodies of the vertebrae. So an indirect technique would be sort of a slower application, sort of coming up to that barrier between the parasympathetic and the sympathetic, and that would be for acute cases, or working with children or infants, something where the nervous system is hypersensitized and is really kind of sensitive. A direct technique would be sort of coming up to that barrier and kind of loading into it. So we're loading into it. So maybe with sports athletes, stunt people, things like that. So I've sort of redefined it that way.
Okay. Your book explains everything, no doubt. There it is. Ligament pain ligament pain referral patterns. When was that published, Robert?
So that was in 2020. I had actually written that a long time ago, and was just trying to figure out how to format it. And there just seemed to be new information always coming in, and new perspectives on how manual therapy works, the physiology behind it, and so on and so forth. So I actually, this is all 100% evidence-informed research, published research documentation, and it's basically just on anatomy and physiology of the neurological innervations of the ligamentous tissue. We'll come back to that in a second. Talks about ligamentomuscular reflex, so there's muscular reflexes for every ligament in the body, and then it talks about the pain referral patterns, which have all been documented research also. But there's actually no techniques. I strategically left out any kind of techniques in this book because the perception and the perspective of what we do and how we do it and how we acquire the outcomes, that's a book on itself. So that's in development right now.
So that's in the pipeline for you now, yeah?
Yes, yeah, absolutely.
Okay, fantastic.
Yeah.
And as far as people at home, if they're interested in purchasing that book, that can be done via you through your website.
Yeah, you can go if you want to. If you're outside of Australia, then
Yeah.
you can go to ligamentpain.com. Oh my God, I don't remember what my address is. Just search for ligament pain. But in Australia, you can go to Terra Rosa,
Cool. Okay, so
and
Buddy's got that. Yeah, Buddyman. Yeah.
yeah, yeah, he's awesome. He distributes the books and the posters that go along with the book.
Oh wow! So they're actually posters that it's sort of, are they similar to like the trigger point posters and that sort of thing? That sort of setup, is it, or?
Yeah, yeah. The posters actually came out first.
Uh-huh.
Those came out in 2016, 17. And they were basically just the evidence-informed published research on the referral patterns, and then the book came out in 2020.
Okay, fantastic. The two articles, the article over two parts that were written up into the journal, that gives a basic explanation behind ligamentous articular strain technique. Yeah.
Actually, those two articles were a little bit different. They were
Okay. Yeah.
when you guys contacted me, they say, "Hey, we're doing a series on the different body parts,
Yeah.
and we're working on the thorax. So what have you got for thorax?" And I thought, well, what's something that needs to be updated? What's some information that is basically based on myth and trend? So I wrote two articles, sort of a two-part article on treating the respiratory diaphragm. So we take a look at the phrenic nerve. So we all learned in school that C345 keeps the diaphragm alive. Well, that's not necessarily true. The neurological innervations for the respiratory diaphragm are not exactly as what we were taught at school. So you have to read the article, you have to go back, find the journal, read the article to learn about that. And then I thought, well, it's all great and fine that now we have, some accurate information on the phrenic nerve and how the respiratory diaphragm is innervated. But how do you treat it? And why do we treat it? And do you even want to treat it? And what does the research say about what the most effective manual therapy techniques are? So that was the second part in the series, was all the research documenting which techniques and how the techniques are applied.
Okay, brilliant. Well, it'll definitely be worthwhile going back to review those. Now, Rob, the other thing that the folks at home can access are your online courses as well. What sort of online courses do you offer?
So they can go to lastsite.ca, and there are online courses currently for the shoulder, for the hip and pelvis, for the knee, and for the leg and the foot. And those videos, there's a ton of evidence-informed research that will bring everybody up to date on pain science, on how we acquire the outcomes that we do with our patients. It gives you, basically the way that I developed it was that I wanted therapists to be able to follow along while I was in treatment of an actual patient. So I'm describing to them the actual hands-on positions, what to be looking for, the principles of the techniques, and it's all done in real time. I didn't want it to be something where, you had some pretty model on a table and the technique was done in 30 seconds. The majority of the videos are, 7 to 10 minutes long because everything is done in real time, and I'm actually treating the person that's on the table. They actually have a current injury.
Fantastic.
So yeah, you can go to lastsite.ca and you can get those.
Okay, no problem. And the future for you at the minute, 2023, everything's starting to open up from a teaching perspective. So what are your plans for 2023?
At the end of 2022, I presented 3 research posters at our local association's research and rehabilitation symposium. This is just to give you an idea of what some of the work is that I've been doing in the background. One thing that we all learned is we learned dermatomes and myotomes. So dermatome would be an area of skin innervated by a peripheral nerve coming from a specific nerve roots. A myotome is a muscle or a group of muscles innervated by a peripheral nerve coming from specific nerve roots. But what about the joint capsules, ligamentous tissue, and cartilage? So I went through and found all the research on all of that. So we were able to now document which ligament is innervated by which peripheral nerve coming from which specific nerve roots. So I've termed that an arthroptome. So we have dermatomes, myotomes, and arthrotomes. From there, I went to the research on ligamentomuscular reflex. So, for example, when you sprain your ankle and your fibulocalcaneal ligament gets stretched beyond its capacity, it sends a monosynaptic and a polysynaptic message to your peroneal nerves, your hamstrings, your posterior compartment to protect and guard and try and stabilize that joint. So that's a ligamentomuscular reflex. And those can happen really quickly, but they can also be long lasting. So these are our patients that we see for a decade that their paraspinals are just like rock hard, right? Well, that's an armoring or a protective mechanism that is due to that ligamentomuscular reflex. So we went through and documented how that all happens and what the research said about that. And then we went into the pain referral patterns for all of these. So these aren't just pain referral patterns that I made up in my head. These are actually things that were documented and published throughout the research. So we documented all of that also. So that's so I presented this at our current research and rehabilitation symposium we had in September. And I'm going out east to Manitoba for their 50th anniversary and presenting the same information there. And it just got a proposal accepted for Ontario at their pain and rehabilitation symposium happening in June. So
wow, things are happening for you.
Yeah,
that would have taken a lot of work there, Robert. What we're looking at there, those 3 posters, that's a big body of work that you've covered off on.
There's so much information, and to try and write the papers on this is just it's a lot.
Yeah.
but it solves a lot of problems, and it solves a lot of frustration that both therapist and patient both have, because the therapist will be so well intentioned and will be trying so hard to help the patient as much as they can, but they're not getting anywhere. And the patient will be doing all their active rehab and the rehabilitation, and they're doing all the things that everybody's telling them to, but it's not happening very quickly, and they don't understand why. So a lot of this information fills in those puzzle pieces, and it kind of makes sense.
Fantastic. It's an incredible amount of work that you've done there, Robert. So if people do want to find out more, now let's get some websites correct this time with you. So if they're wanting info about yourself and what you're up to, what's your website address?
They can go to lastsite.ca.
Yeah. So that's the place where they'd be finding online courses?
Yes.
Fantastic.
And then they can go to ligamentpain.com.
Yeah.
If they're outside Australia, go to ligamentpain.com to purchase the book or the posters. And actually, all of the pain referral images are all in the book, along with. So when we got all this information, for example, for the neurological innervations, I also looked for any type of imaging to show what these actual neurological innervations were, and they weren't accurate enough. So what I did is I put, if you can see, I put the chart in the book for all the neurological innervations. So nerve root, peripheral nerve, and tissue innervated, and then we created the new neurological image to go along with it. So I've done.
So it all matches up. It gives you that visual. Yeah.
So the book has, the neurological innervations. It's got the images to show the proper neurological innervation for each of the joints for the whole body, and then all the pain referral patterns also.
All right, brilliant, fantastic. Well, Robert, we're gonna leave it there. We're gonna have to wrap it up. But it's been really interesting talking to you. Again, the articles can be found in our journal. Robert's got his book
These are,
there. We've got
I don't
online
know who's doing
courses.
your I don't know who's doing your
Yeah.
covers, but these are awesome covers.
Well, I'll let Nick know. Nick, our graphic designer at the association, he does a wonderful job putting those together. So yeah, I'll pass that on. Hopefully, we're going to see some more of you too. Hopefully, with some webinars or some other online stuff. And one day, when travel allows, then maybe we'll see you out here in Australia running some workshops as well.
Absolutely. I was out there in 2018 and just had an awesome time. Just amazing therapists that I had contact with down there. It's fantastic.
Brilliant. Okay. Thanks for your time today. Really appreciate it on our Connect show. And yeah, hopefully we'll get to see you out here in the near future.
Absolutely.
Take care, man.
All right. Thanks, guys.